I'm Paul Wilding. I'm a GP partner at Slaithwaite Health Centre practice in Huddersfield, West Yorkshire. And we're in the news because of draconian PMS cuts that are effectively decimating our practice. Our budget will be cut by 44%, and it renders our practice completely non-viable in a relatively short period of time, not surprisingly. And we decided we wanted to do something about that, so all we did was we talked to our patients. We held a private meeting with our patient group and invited representatives. And what we found is that our whole community has rallied to support us, and certainly made us feel better. But it's not just the rallying that's helped. They've actually taken some practical measures to try and oppose these cuts. Probably the most significantly, one of our patients felt so strongly that about having not been engaged or consulted with, that they took some legal action, and they're taking legal proceedings against NHS England. The second thing that happened was that we were inundated with requests of help and support from our community, not just from our registered patients, interestingly. The third thing that happened was we started to get contacts from other practices who were worried about their viability, worried about the impacts of the cuts. And slowly but surely other practices around the country are beginning to stand up against these cuts, because fundamentally they're unlawful. The issue here is that the government and its agencies have statutory responsibilities to involve the public in changing services. So our town, Huddersfield, is in the news at the moment also. It's not just about Slaithwaite Health Centre and PMS. We're in the news because the commissioners have embarked on a public consultation around the future of our A&E department and local hospital, Huddersfield Royal Infirmary. And that has become global news with Hollywood celebrities involved. So if they have to do a consultation about A&E departments and hospitals, they also have legal responsibility to do a consultation about GP services and community services, and they've failed to do so, which is the issue that our patients are most annoyed about. So it'll be interesting to see what happens next. We certainly feel a lot better. You know, it's tough running a business that's facing those kind of cuts to try and keep the show on the road. It's tough looking people in the eye as your colleagues that you employ and work with, knowing that these cuts are coming. But the support from the public has been overwhelming, quite frankly. We feel a little bit better. We feel some hope with this patient-led legal action. And we're excited that other practices nationally are now standing up. So we've established a website called family.sos.co.uk, and we would urge PMS practices, and indeed other struggling practices with other contracts, to look at our website, look at the section called I'm a GP, and look at the news archive, which tells the whole story. And our message to GPs is, the time for talking is over. It's the time for action now. You're running out of time to oppose what may well be unlawful cuts. Go on the website. It'll give you some ideas of what you should be doing. The main thing you should be doing is going public and telling the public, because nobody else has told them.